60s, 1 female and 4 males in their 70s, 6 females and 3 males in their 80s, and 5 females and 3 males in their 90s. 22 of those 23 deaths are linked to aged care outbreaks. There are 532 Victorians in hospital. 29 of those are receiving intensive care, and 11 of those 29 are on a ventilator. The Chief Health Officer released later today will have a fully reconciled testing number. We're just working through latest information from labs, but we have clearly done more testing overnight, but the final number will be included in the Chief Health Officer's release later on today. There are 4,151 cases with an unknown source, mystery cases. 35 have been closed out and added to that total since yesterday's update. There are 391 healthcare workers who are active cases, so those numbers have stabilised and continue to fall, and that is obviously good news. We don't want any of our healthcare heroes to be getting sick doing the work that they do. That's been a feature of many of the announcements and much of our discussion this week, and I want to thank all the team who are working very hard, whether it be in terms of the provision of PPE, analysing the data, working as hard as they possibly can to make sure that our healthcare environments, aged care all the way through to hospital care, is as safe as it possibly can be, obviously for patients, for residents, and most obviously for staff. We send our best wishes to all of those staff who are unwell, and again, it's a powerful reminder to every single Victorian that by playing our part, by doing what we need to do, following the rules, coming forward, getting tested as soon as we get even the mildest of symptoms, we're not just protecting our family and every family, we're protecting those heroes, the last line of defence, those nurses and doctors, AMBOs, all of our hospital team, all of our healthcare team. That's a really powerful way in which we can thank them for their courage and their commitment, their absolute compassion and the skill that they bring to their very considerable task. We thank them and let's all of us do what we can to keep them safe. There are 3,308 active cases across the state, so those numbers continue to fall, which is good news. In terms of the regional metro split, as I always point out, these numbers don't always perfectly reconcile just because there's a number that are still being investigated, but there's now 198 active cases in regional local government areas that are under stage 3. To give you an example, across a number of key regional communities that we've been speaking about, they're key for that purpose. Geelong, the Greater Geelong area, 71 active cases. Greater Bendigo, 16, and Ballarat has 6 active cases. That is a much better position than we were in a few weeks ago. Those numbers are falling. Those numbers will continue to fall, obviously, as people go through their active period as a positive, and then we'll see those numbers continue to fall. But there should be no sense of complacency in those communities or in any community. Regional Victorian numbers are low. We're doing everything we possibly can in a really strong partnership between the government, public health team, all the workers, if you like, in this, as well as families right across regional Victoria, communities right across regional Victoria. We've got to continue to do everything we can to keep those numbers low, but that is a pleasing decrease and a steady decrease in terms of the number of active cases in regional local government areas. In disability facility settings, there are a total of 48 active cases. In aged care settings, there are a total of 1,412 active cases. And in terms of aged care shifts that have been worked by hospital staff, to whom we are so grateful, we're now up to 3,062 shifts that have been worked. That is a massive effort in terms of people who would normally be working in a very different environment. They've gone into aged care homes. They have provided the very best of care, helped to stabilise those environments when many of them could not have been described in those terms. They've done a mighty job, and we're very proud of them and grateful to them, and I'll continue to update you as those numbers grow. In general terms, though, we have seen some stability come to aged care settings. That is a good thing, but it's by no means over. There needs to be the important continuation of that joint approach where all governments together with agencies, are all working together as one, focused on only one thing, and that is the very best care for residents and patients, and then providing the best information to families. That is very challenging, but our staff, a big team, are doing an amazing job in very, very difficult circumstances. Now, yesterday there were some questions in relation to workplace safety and some of the work that's gone on by our WorkSafe inspectors. That workplace blitz has been going all year. If I give you a sense of things from the beginning of the pandemic and then a more up-to-date, or the last period since the end of July. So since the pandemic started, there have been 5,259 visits made by WorkSafe inspectors, and there's been 203 notices that have been issued to employers for breaches, large and small, of those COVID-safe work plans. From the end of July, so when this most recent stage 4, a new set of rules, a really intense focus on trying to deal with workplace outbreaks, some 916 visits, and there have been 78 notices that have been issued. Now, if we can provide you with any further information about, I don't have it to hand today, but in terms of the nature of those breaches, whether those matters have been closed out, if you like, whether people have rectified whatever the deficiency in their COVID-safe plan and the way their workplace was operating, I'm more than happy to try and get that to you, and that can be a feature of an update at a later point. In fact, we're more than happy to continue to update you on those matters as we go. Now, just in terms of, before I ask Minister Williams, who's joined us today, to talk about 5 additional orange door sites. Victorians, I think, would be familiar with the fact that these are essentially a hub for all the different services that somebody who has experienced family violence might need, they and their kids. It's a key recommendation out of the Family Violence Royal Commission. It is a really important way in which we can provide support and care, assistance to each and every person who is the victim of family violence. It's a very important response, and we had made commitments, of course, to deliver all the recommendations of that Royal Commission, and we are wasting no time doing that. All 227 are being actioned. Some of them do take time, but Minister Williams is also able to provide an update on our progress against those 227 recommendations as well. I just wanted to make the point that despite the fact that we have stage 4 lockdown in metropolitan Melbourne, stage 3 in regional Victoria, it is always permissible. It is always appropriate, if you felt that you needed to leave home for your safety, if there was a family violence issue, no matter how that manifests in your home, then of course you are able to do that. You're not going to get into any trouble for going and getting the care that you need, getting away from that violence. That is a point that's worth making, just so that there's no doubt in anybody's mind. We have a very strong record of investing in this sector. It is always disappointing to have to invest this sort of money. We would obviously prefer to see far less of this sort of behaviour, but whether it be trying to change attitudes towards women and therefore outcomes for women, all the way through to very practical investments in the support system that is critical to providing safety and security, and not just changing lives but saving lives. This is work that continues. Some of the challenges we face have been, I suppose, very clearly exposed in recent months, but there's also changes and shifts in some of the things that we need to do, and Gab spoke at some length about the need for further support for those people who have perpetrated family violence or are at risk of perpetrating family violence when last she joined us. So I'll let her go through the details of that. Just finally, before I ask Gab to add to my comments, Victorians are doing an amazing job. They're doing an absolutely amazing job in very challenging and difficult circumstances. And I think every Victorian can be positive about the fact that these numbers are coming down, this strategy is working, and there will come a time, hopefully soon, where we're able to see those numbers in double digits, and then we can have, with greater confidence, a really clear discussion about what the back end of September looks like, what October, November, December looks like, pushing into 2021. That'll take two different forms. There'll be both a clear plan, very detailed, indeed a massive plan to repair the damage that this pandemic has done, to make sure that jobs and skills and strength across our economy and communities are at the forefront of every single thing we do. And it will also be, as best we can, and it always has to be heavily caveated, I suppose, just in terms of daily numbers, but as best we can, we quite soon hope to be able to give people a roadmap, a clear plan about what coming out of stage 4 looks like, what opening up looks like, what finding COVID normal looks like. I appreciate, I know and understand very deeply how challenging this is, but this strategy is working. These numbers are coming down. Of course, that shouldn't take away from the pain and the loss that those 23 families today are dealing with, and sadly there will be more tomorrow. That is the nature of this wildly infectious virus, and it just, I think, brings into sharp relief for all of us. The alternative to this would be to basically ignore the fact that this is transmitted very quickly, that it is a wicked enemy, and that we would, if we didn't have these very challenging rules in place, we would simply see our hospital system completely and utterly overrun. And that's not just a matter of COVID patients not getting the care they need, but people who every day, heart attacks, strokes, motor vehicle accidents, people who need urgent care, they simply would miss out also. So as challenging as this is, the strategy is working. We do have to, all of us, look out for each other, try and provide whatever support we can to get to the other side of this. And we've got to defeat this second wave before we begin opening up, otherwise we will simply be in the early stages of a third wave, and whilst that might be, there might be some significant respite for people for a short period of time, we would then be in even worse circumstances very, very quickly. That's what our experts tell us. That's why we can't open up right now, but every Victorian should be clear about the government's intentions. All the team is working as hard as we can. We want to get past this as fast as we can. These rules won't be in place for a moment longer than they need to be. And then a lot of work's going on at the moment, and we'll have many announcements to make about repairing the damage that this global pandemic has done. And there will be a singular focus on jobs, on making sure that we look after those who have lost work, that we look after those who are really facing very difficult circumstances in terms of their business and their prospects for the future. There is, in every sense, cause for people to be positive about the fact that this strategy is working, and we will get past this. We will defeat this thing, we will get past this second wave, and then we will be able to open up, we will be able to begin that long and challenging process, but one that I think we're equal to, of repairing the damage that this pandemic has done to all of us across the board, in businesses large and small, communities large and small, families, individuals. We will get that strength back. We will resume that position of national leadership where Victorians are always at their best, when we're out in front and leading. Just finally, I would just again make the point, as I did yesterday. I'm very grateful to members of the crossbench. We're having very, very productive discussions with them, and I'm very confident that we will get to an outcome that both protects public health and gives us the rules that we need to plan to open. Not rules to stay closed, but indeed rules that will assist us in putting together a long-term plan to repair the damage, to get people back to work, to get businesses up and running again, and to, as I said many times, to find that COVID normal. I'm very, very grateful to those crossbench members. We've been, as we always do, engaging with them in good faith, and those discussions are progressing very well. And we'll have obviously more to say about that as we get into the sitting week next week. To take us through some of those family violence investments and other decisions, I'll now ask Minister Gabrielle Williams to add to my comments.
Thank you, Premier, and thank you all for joining us here today again. As the Premier outlined, and as I've had reason to say here before, with more Victorians at home to slow and stop the spread of the coronavirus, we know that the risk of family violence has increased over this period of time. Sadly, we know that for many in our community, home is not a safe place to be, and this has really highlighted for us how important it is that we continue with the work that we've been continuing on until up until now on the Family Violence Royal Commission recommendation implementation, and how important it is to make sure that we're continuing to meet the scheduled timelines as best as we can for those recommendations, and continuing to rebuild a family violence system that was better than the one that we had before and better meets the needs of the victim survivors that rely upon it. To echo, before I get into the actual announcement today, to echo the Premier's sentiments, it really is critical that people understand that if you are at risk of family violence or experiencing family violence during this phase of lockdown, you are allowed, entirely permitted to leave. It is an entirely legitimate reason to leave, and that service system supports are still available to you if you need them. Help is there if you need it. So we would really appreciate if that message is shared far and wide, so that we can have people availing themselves of the help they need to minimise the risk that might be presented to them. My announcement today has 3 parts, and the Premier has preempted a couple of those. Firstly, I'm announcing the expansion of the Orange Door network with the rollout of an additional 5 Orange Door areas. Those areas include Melbourne South, Inner East, the Ovens Murray, Wimmera South West and Outer Gippsland, which will be operational next year. And we can also announce the location of the primary site in 2 of these, which is in the Inner East, which will be located in Box Hill, and the Ovens Murray, where the primary site will be located in Wangaratta. We'll have more to say about the primary site locations for those other regions in due course, and of course also about the locations of access points, which are effectively other points of entry to the network in those regions, alternative entry points, particularly in larger regions where there might be multiple large population centres. So we'll have more to say about that in due course. For those who may not know, the Orange Door network brings together family violence services, it brings together children and family services, perpetrator services, Aboriginal services, and essentially operates as a coordination point. It connects people, no matter where they live in that region, to what they need when they need it, and it's essentially designed to make it easier for victim survivors to navigate what is an incredibly complex system, by essentially doing that for them, streamlining that navigation to just ensure that we can minimise the stress levels for those victim survivors who may be at risk at what is, I think we could all recognise, a very stressful time in their lives as it is. It's also worth noting that we've already got 5 Orange Door sites up and running in Barwon, Inner Gippsland, Bayside Peninsula, North East Melbourne and Mallee, and we'll have another 3 coming online very shortly, which were effectively the phase 2 of the rollout. Those were in Central Highlands, Loddon and Goulburn. Central Highlands and Loddon we expect to be open by the end of the year, and the one in Goulburn, which will be in Shepparton, the primary site will be in Shepparton, will be open in the first half of next year. In terms of the second component of today's announcements, which the Premier also preempted, which was to talk to you about where we're up to in that family violence reform as a whole. There was 227 recommendations of the Royal Commission into family violence, and we committed to implementing every single one of them, and we're well on the road to doing that. I can now announce that we've acquitted 166 of those recommendations, which means we're about 2/3 of the way through that list of recommendations. I mean, we've got about 61 to go. All of those 61 remaining recommendations are underway, but I think it's really important to note that the work for most of those is ongoing. This isn't a checkbox exercise. This isn't about completing the list and walking away. This is about continuing to build a system that meets the needs of the community that it is there to serve, and to meet those needs in a way that delivers better outcomes than it has previously. This is about joining up a system that has, as the Royal Commission told us, previously been very siloed and very disconnected. In terms of some of the highlights of that recent tranche of acquitted recommendations, included among them is the launch of the Family Violence Jobs Portal, the development of a family violence training program for medical practitioners, and the trialling of the use of body-worn cameras by Victoria Police during family violence incidents. And we're awaiting the evaluation of that trial and awaiting very eagerly to see how that worked and how that added to the safety of victim survivors of family violence. Finally, the third component of today's announcement was around an additional investment we're making into prevention work. This is work that is designed to stop this violence from happening in the first place, stop it before it starts. So we'll be investing an additional $3.4 million in prevention work with a focus on our Aboriginal community, our multicultural communities, and on those with disabilities. Understanding, of course, that family violence affects every part of our community, but it's really important that we have a response to it that is culturally appropriate and that gets the best outcomes in a community-led way, and getting advice from the experts, from those people within community who can tell us the best way to have some difficult conversations, who can best identify the needs within those communities and be best able to guide us as to what we need to be doing differently in some settings to be adequately able to reduce the risk within those communities. I'm happy to take questions on that or anything else, but before we do, did you want to? Yep, sure.
So not much to add to what the Premier's announced, but certainly we're seeing, keeping a very close eye on all the local government areas in Casey, Hume, Wyndham, Dandenong and Frankston. Case numbers are continuing to come down in regional Victoria. 5 cases yesterday in Geelong, none in Bendigo and none in Ballarat, so certainly reassuring there. So our numbers are continuing to come down. I think that's a testament to all the sacrifices that Victorians have been making, and we can really see this happening now, but we really need to stay the course for a little bit longer, so to get these cases down to a level that is much better than we have at the moment. Take questions?
Is there an update on the R number?
So the last one I saw was about 0.87, I think it was. But obviously that's a retrospective number that's estimated, so that's going from about 2 weeks ago, and that's the sort of latest you can do that. I would expect it probably to be a little bit on the lower than that at the moment, but that's certainly encouraging, and it's certainly below 1, which is where we want it to be.
And are testing numbers where you want them at the moment, or are they still a bit low?
Yeah, so we're just trying to reconcile them now. This obviously it's very important. We want to make sure that we have an exact number, so that'll come out later today.
The aged care and healthcare worker infections holding us back a little bit?
Look, I think anywhere where there are outbreaks is what does concern us. I think one of the features of this epidemic is super spreading events, and in epidemiology we call this over-dispersion. So most people actually don't transmit to anyone at all, and a smaller number of people will transmit to a larger number of people, and we really need to focus on all of those. Aged care and hospitals are obviously important there, but also other workplaces as well.
Of the numbers today, how much of those are linked to aged care and hospitals, particularly Frankston Hospital? We're noticing. As I understand, yesterday there was one new case reported at Frankston. There are 45 cases reported at Frankston in August, and there'll be further information on that. I can see what other things I can get you. Are you seeing any trends though about community transmission dropping or going in the right direction? Because obviously you and Brett have both said that's the key number for getting us out of these.
So these mystery cases. I mean, I think it is difficult to tell. Certainly, as a proportion of cases, they're sort of staying the same, but obviously the numbers are coming down, so those numbers are coming down as well. It is a little bit difficult because the investigation needs to be done, so they're necessarily a couple of, a day or so old. But the numbers are sort of turning with the rest of the numbers as well. And I think certainly, for example, in regional Victoria, where the numbers are relatively low, we can start to track, form links between cases, so we know where most of those cases have come, and that's reassuring, and that's what we hope to see in metropolitan Melbourne as well.
How many cases are currently under investigation at the moment?
I haven't got that number. I'll see if I can get you.
And is the Department of Health and Human Services doing anything to shorten the time frame it takes to investigate a case and close it?
Yeah, so there's continuous improvement in this. There's been, as you're probably aware, there's been a new computer system that has been put into place. There's electronic notifications from labs. There's now this new online form for medical practitioners to notify cases. There's an enormous team of the disease detectives that are calling them. We certainly know that we're able to at least try to attempt to call all cases within 24 hours. Obviously, you know, for various reasons, we don't always catch everyone, and then for the others, we're trying to door knock as many as we can of those.
And then in terms of investigating the origin of a case, how long does it take to close a case on average, and how are you improving that?
So I haven't got that figure, and I'll see what we can get. So that's all part of the. We're certainly keeping an eye on all of that. It does take a day or so, and sometimes you have to go back to a case to, you know, to just check information or to verify things. And again, it's part of sort of a continuous improvement. We're keeping an eye on a lot of those figures to make sure that they're closed out as soon as they can be.
Just on aged care, there's still active cases seems to be going down very slowly. Are we still seeing new outbreaks, or are we seeing close contacts now being infected? Where are most of those cases now?
So it takes closing out again. So releasing a patient from isolation is sort of a complicated process, and particularly for patients that are in hospital, it takes a little bit longer. So we don't expect those cases to that number of cases to fall as quickly as for people, for example, who are in the community. So we're seeing less outbreaks in aged care. Obviously, the ones we do have are really important, and we're trying to stop as much transmission as we can from there. But there is a decrease in the new cases, and I think this represents sort of the recovery of people, and it takes some time for people to recover.
And are patients who had been in hospital being allowed back into some of those key, like St Basil's and Epping Gardens? Are they now functioning as they were? Have those people been allowed to go back?
Yeah, so I'm not sure about those ones specifically, but I certainly do know that people are going back to their homes as they recover. I think it's obviously very important that they're no longer infectious when they do that. Obviously, things have to be put in place, and also, you know, cleaning has to be done. You know, the clinical support has to be there. So it isn't always a simple matter of just saying you're ready to go, off you go. A lot of things need to be put into place to make sure that it's safe for them to go and that they're adequately cared for.
How many people in hospital now are from aged care?
I haven't got that figure, but I'll get that to you.
And do we know how many hospital inpatients, or if someone who gets admitted to hospital for something non-COVID related contracts COVID in hospital?
I don't have that figure. We'll see what we can get to. In hospital, obviously, patients with COVID and suspected COVID are separated from other patients, so there's a lot of things that are put into place to try and protect people that obviously didn't come in with COVID.
Have there been any cases, though, where a patient has perhaps contracted it from a staff member in hospital?
I don't know how many for sure, but I know that it has occurred. But now we have, for example, all staff wearing masks to make sure that that risk is limited as much as possible.
So how recent were those cases?
I don't know the details of those cases, but I do know there have been some.
I was just getting a sense of, was it April or was it this month?
I don't know. I'll have to look into that.
Given the drop in regional cases, are you comfortable with the testing levels out there? Is there a sense of complacency that's sort of crept in, do you think, or are people in the regional areas?
We're keeping a pretty close eye on testing levels, so we don't want to make sure that we're not missing anything in particularly in the regions, and the numbers have been keeping up, so that testing rates probably aren't quite as high as they are in some parts of Melbourne, but certainly in areas that we're concerned about, testing rates are pretty high, and actually all the regions, even those without cases, are probably comparable to, you know, testing rates in the rest of Australia as well. So we're testing quite a lot in Victoria.
And do we know which, I guess, local government areas in Melbourne or which postcodes have seen a dramatic decline in the number of tests being conducted?
We'll have to get that information to you. We certainly there's a lot of local government areas. We're certainly keeping an eye on all of them. I know that testing rates, for example, in Geelong are relatively high at the moment, even places that haven't had cases like Glenelg, the testing rates are relatively high there as well.
What about in areas like Hume, Moreland, Casey, Wyndham, where there are a high number of active cases and high number of confirmed cases? Do you know just off the top of your head what testing rates there are like?
I'll have to get that data to you, but I do know that they are high in those areas.
Are they high?
Yeah.
Chris, are you comfortable with Parliament sitting next week? Is it safe?
Yeah, so I understand that CHO Brett provided advice to the presiding officers. Parliament is a workplace like any other, and it's important that it's made as safe as possible. So I understand that there has been ongoing discussion between the presiding officers and Professor Sutton to make it as safe as possible, and that includes specific advice for everyone who's attending, and more specific advice for those who are attending from rural and regional locations.
And you're comfortable, the health advice is comfortable for regional MPs to come to Melbourne for that sitting?
We've provided our recommendations, and it's up to the presiding officers to do that. There's quite a long list. It's about wearing masks, making sure that there's adequate cleaning, that there's hand sanitizer available, a lot of things like that, and making sure that people don't attend work. Parliament while unwell is probably a really important one.
That definitely includes provisions that will allow MPs to come from the regions.
So they're recommendations that are made, so yes.
Premier, would you be happy with virtual voting in the Parliament?
Look, I think, Rich, that there's been a multi-party working group, and very grateful to them for the work that they've done. I'll leave it to the presiding officers to make announcements, but I think that we've seen arrangements in different parliaments across the country, different parliaments across the world, where they've used tech to try and facilitate the safest operation of those settings. So I'm certainly comfortable with that, but ultimately that's a decision that's made by the presiding officers.
Are you comfortable with a 6-month extension of the state of
emergency
powers?
Well, what I'm always motivated to do is to work as closely as we can in as respectful and collaborative a way as possible, not just on these measures, can I say, but this is the approach we take with the crossbench on everything, no matter what the subject matter. And indeed it'll be the approach we continue to take on many and varied issues that they will raise with us, that we will raise with them. It's been a very positive process. It's not concluded yet, but we are having very productive discussions. And again, as I said earlier on, not for the imposition of rules to keep the place closed, but indeed making sure that there's certainty so that we can put in place a plan and a set of rules that allow us to open up. That's what we're focused on. Where that lands in an ultimate sense, we'll have to wait and see, but I'm really confident that through those discussions, and again, I'll say thank you to those crossbenchers for the positive way in which they're engaging with us.
You are aware that the 6-month timeline has been put on the table by the Health Minister, and you're happy for that?
Well, I'm not going to be commenting on negotiations that are ongoing, nor am I going to conduct negotiations with people via a press conference. I don't think that would be fair.
Have you spoken to any of the crossbenchers personally?
Not about these matters, no.
And you comfortable with more parliamentary oversight for the purposes of extending this powers?
I've got no problem with that at all.
Are you happy to have the crossbench maybe take the chair of a committee that oversees government?
Well, we have a Public Accounts and Estimates Committee.
Chaired, with all due respect, by Labor majority.
Well, you don't have to be respectful about it, it's a fact. The PAYAC is chaired by a government member. Anyone who wants to describe that committee as anything other than rigorous, well, go for it. But I think we've had a pretty good demonstration that that's a fairly rigorous forum, and that's a good thing. Its work is very important. That's why I turn up. Not every Premier in the history of this state has taken the opportunity to turn up at PAYAC. I can think of one example where that person refused to go. I turn up and I answer questions as best I can. That won't be changing. PAYAC's got an important role. The other thing too, of course, is that they will move fairly soon into the more traditional role that they play as well, which is, of course, to look at the budget, which will be in fine detail, which will be later on in the year.
Will you agree to extending PAYAC and maybe including another non-government MP on the committee?
No, I'm not here today to announce the outcomes of any discussions one way or the other, and I wouldn't read that to be me confirming that or otherwise. I think it's
just asking your thoughts on what you think about that.
yeah, and I suppose I'm putting it to you that the best thing for us to do is to engage with the crossbench directly. I am very grateful to them for the productive and the very important way in which they're engaging with us, and when we get an outcome, and I'm very, very confident that we will, one that both protects public health, acknowledges that we can't go from stage 4 to stage 0 and have no rules at all, and that if you want to open up, and that's exactly what we want to do, you've got to have a framework, you've got to have a structure. Again, not rules to keep the place closed, but rules that will actually enable us to open up, to save jobs, to create new jobs, to see businesses through this, and to see us find that COVID normal. And then, hopefully beyond that, once we get a vaccine, to go back to normal in its truest sense.
Gabbo, what do you add?
About a road back to normal, so many businesses wondering when they open up how they are going to survive. Do you have a game plan at all to help people fix what the pandemic has caused?
Well, the first thing is to deal with the health issue, and I think we've seen a lot of commentary over the recent months, not just here but across the world, that if you don't deal with the health challenge first, then that big job of trying to recover, trying to repair that damage just becomes much, much harder. Indeed, I think impossible. So the first thing is to have a strategy to drive the case numbers down. We know that causes considerable pain. No one's pleased about that, but if there were an alternative, then of course we would use that. Then, once we've stabilised numbers, once we're past that second wave, and we're certainly on the downslope of that second curve, then I want to assure workers, businesses, families, communities that there will be a series of very significant announcements that are about jobs, both saving jobs and creating new jobs, and making sure that we support all of those who have been harmed and damaged by this global pandemic. That's not for right now, but I do want to reassure people that just as there's been direct business support, a number of announcements, there's currently a $2.7 billion building works program, hundreds of quite small projects that help that part of the construction sector. There will be industry and sector specific commitments. There will be massive investments in trying to create demand and confidence, trying to get us to the other side of this. And that is absolutely in accord with the advice and indeed the urgings of Philip Lowe, the Governor of the Reserve Bank, Stephen Kennedy, the Head of the Commonwealth Treasury, and indeed comments that were pretty clearly made, I think, last Friday by the PM after the National Cabinet meeting. We have to use the state budget to protect household budgets. We need to acknowledge that the chances of paying back the debt that we've had to go into through this 1 in 100 year event, until the chances of paying that off until you get, and unless you get the economy growing again, are very, very low. So whilst that isn't for today, there is an enormous amount of work going on, and we'll have many, many announcements to make.
You said in your opening that the numbers are stabilising, and now you've said that you will tell people about the roadmap when they've stabilised. Can you, obviously, as the previous journalist said, that businesses are saying that they need weeks. They need now.
Yeah.
We're, 4.6 weeks in.
Yep.
We're now at the point that if we are opening up on September 13, that people need to know. So can we at least get a date of when you are going to announce your roadmap and what numbers?
No, Alex, I can't give you that. What I can give you, though, is this commitment which I've always given, and I think if you were to look back at each of the decisions and steps we took to ease coming out of the first wave, we were very committed, and I think we delivered as best we possibly could, as much notice as we possibly could. The challenge at the moment is, and again, this should not be seen as anything other than these are the facts of the matter. This is the difficult reality that we all face. If I could provide a date and a day-by-day, very detailed, sort of chiselled in stone roadmap, then of course I would do that. I'm not in a position to be able to do that. But what I'm foreshadowing is we will, as we always have, we will give people as much notice as we possibly can. But I do want to make the point, and I don't think there's no quarrel here. I just want to make the point that the notion that we could go from stage 4 to where we were months and months ago, essentially very close to being completely opened up. That won't be able to happen. It will need to be a gradual process. No longer than it should be. But of course, we're going to have to step down from this in a gradual and cautious way. But
you must have a clear plan. If you said that, because you've been saying for 2 weeks now that work is going on behind the scenes, so you must have an idea of what that gradual plan is going to look like in terms of stepping down.
And as soon as I can announce it, I will.
So what restrictions will you look at easing first?
When I'm ready to make those announcements, then I will make those announcements. And I don't think that's an unreasonable position. What I would say to you is it's of no utility, it's frankly of no use whatsoever to be trying to paint a picture when we just don't know. We just don't know exactly what that will look like or when. However, every Victorian can be positive about the fact that we are, in my judgment, and I think in the judgment of the health experts as well, we are probably ahead of where we might have expected to be. Those around 100 number, if we can continue to see those numbers fall, and obviously we all love them to fall as quickly as possible, then I think that we've still got a couple of weeks to run, and we are seeing, we're on the cusp of double digits. It's not that long ago that we were at 700 and sort of mid 700s. The strategy's working, and that's really important. Now, is it challenging? Yes. Is it really painful? Yes. The alternative is, I think, even more painful. You only get one chance to defeat this in its worst phase. That is this second wave, and making sure that we have really got it down to the lowest possible limit, so that we can be confident that we can keep a lid on it. It's right down in small numbers. That's when a plan to open up and a plan for rebuilding and recovery will be most certain, and not just the beginning of a third wave. That's what we're trying to avoid.
I appreciate that the general public is frustrated that you are trying to ask for more power, and you're saying, believe me, it's not my intention to keep you locked down a day longer than necessary, yet you're asking for more power to do it without giving anyone a roadmap. Would you commit to announcing how we ideally move to the next stages before the legislation is voted on?
I'm not in a position to give that commitment, but we will, as I've always said, we will work as hard as we possibly can to provide people with as much notice as possible. What I can say, Alex, and what the numbers should tell all of us, we can't open up right now. At 100 plus cases a day, we cannot open up right now. And I think that Victorians, as painful and as challenging as this is, I think they understand that fact. That's why we're working as hard as we possibly can to drive those numbers down further. Once we achieve that, we'll be able to outline clear plans. I don't accept the notion that we're asking for anything more than what we've got now. And if it's your view or any other Victorian...
You're asking for an extension, but you're actually not providing any information to the public on how we're going to progress.
Well, you're putting that...
You're also not even announcing a deadline of when you will announce that.
Well, Alex, you're putting it to me as if that's some choice. And what I'm putting back to you, as I have done...
You can share with the general public. You don't have to share every single detail or definite deadlines, but you could give people an idea of at least a date of where you think that you will be able to provide this information, especially to businesses.
Right. Well, I'll make announcements when I've got advice and when I've got the certainty that they mean something. That's always been my approach. I'm not going to just invent things that are not supported by the data.
All right, moving on to the Belton Road.
Sorry, Alex, can I share it around?
Well, you can share it around, that's fine. That's fine.
We'll get to Belton Road. Just in terms of the mental health impact that the lockdowns had on people,
Sure.
You've made a bit of a deal of that. The Coroner's Court's put out some statistics today showing there hasn't actually been an increase in suicides. Does that surprise you, given, I guess, the distress that this has placed a lot of people under?
Yeah, sure. Look, I wouldn't comment on what the coroner's put out today. They are the facts of the matter. I'm not making a judgment either way. We're always very careful when we talk about these matters also, but I don't think there's any doubt that there's significant pain and grief and loss and significant challenges that many, many Victorians are facing. And for some, it'll be, as I've said a few times now, it'll be about they came into the pandemic with some mental health challenges, and this may have made things worse. For other people, they may never have experienced depression, anxiety, mental health challenges, and they are experiencing that for the first time. And that's why we've reached out as much as we can to broaden out services, to provide to everyone who needs support and care just that. But I think that is one measure, but it doesn't in any way diminish my commitment and our absolute resolve to make sure that we're supporting everybody who's doing it tough. And there'll be different circumstances. Every person is unique, and for some people that'll be acute mental illness. And that's why we're growing the number of beds in our hospitals. For other people, it'll be counselling and other support services, and we're growing that part of the system too. So I wouldn't use that in any way to diminish just how big a challenge we have, and that's why we're making very substantial investments beyond that. And look, and I fully appreciate that as soon as we can provide people with certainty, as soon as we can provide people with that clear sense of a plan, but it's got to be driven by the data and the science though. I do hope to be able to have more to say soon about what that next stage would look like. The exact detail though, we'll have to calibrate that based on the numbers we're seeing and based on the best of scientific advice. But I know that'll be a comfort. That'll be very important for every Victorian, and particularly those who are doing it tough. But I suppose the balance I'm trying to strike, Lundy, is to be as frank and as accurate as I can be. And I don't want to be providing great levels of detail to people that I really don't, but neither me nor the medical team have any real confidence in. I think that potentially makes matters even worse. So that's what I'm trying to avoid. That day will come quite soon, and then we'll be able to talk in more certainty. But it's got to be based on facts. It's got to be based on the data and the evidence. And at this stage, it's too early for us to have a prescription, a detailed list of everything that the next stage will look like and the stage after that. But I'll tell you one thing, it certainly will involve some rules to facilitate opening up. Otherwise, you simply couldn't.
Are you concerned about the Prime Minister's plans to tear up your Belt and Road MOU?
Well, look, if the Prime Minister's got time to be doing those things, then that's fine for him. I don't. I am exclusively focused on fighting this virus and then making sure that we have got the strongest economy that we can possibly have on the other side of this.
Are you concerned about the impact it might have on trade?
Well, I dare say that given announcements the Prime Minister's made today, he'll no doubt very soon be able to list a full range of other free trade agreements and other markets that we'll be sending Victorian products to. I look forward to that.
Are you worried about agriculture?
Well, I just said to you, no doubt the Prime Minister's announcements today will be accompanied by a detailed list of markets and free trade agreements that he proposes to do, so that there are, just as much demand, perhaps even more demand, for all those Victorian products that we send to lots of different countries.
Are Australian students important for international education?
International education is our biggest export. It's very, very important, and that's why we're so saddened to see it basically closed down at the moment. That's why we'll work really hard to make sure that we get that sector back on its feet. Not just important from a dollars point of view, as critical as that is, but the partnerships and the friendships and the linkages that pay dividends for decades in many different ways, from having students from all around our region and the world coming and studying here and seeing exactly what we're all about. That's a massive boost to us, not just in dollars and cents, not just today, but in many different ways for the longest time.
Some people are critical of this deal as simply it's a propaganda tool to undermine the federal government. Is that a concern that you share?
Well, my concern has always been to grow jobs, and I've always seen these arrangements and all of our arrangements, not just with any one country, but with all the different countries, different states, different provinces, different regions that we have relationships with. They've always been about a passport to export. They've always been about getting more Victorian produce, more Victorian products, more Victorian economic activity. So we're all about getting more product overseas. We're all about making sure there's more people at home employed, and that's as certain as it can be.
Even if that undermines national security?
No, I would never concede that point. But again, foreign affairs is a matter for the federal government. I've had a different
Isn't
view.
that the whole point of this? Foreign affairs is a matter for the federal
Well, it
government,
is.
not Victorian government. So you shouldn't.
Again, I
stay
just
in the
make.
lane, basically. Isn't that
Well,
the
I
argument?
would just make the point, Rich, that if anybody in Canberra thinks that this government is not going to do everything we can to try and have more jobs in Victoria, and I would never speak for other premiers, but presumably other premiers and First Ministers, they're pretty keen to have more West Australian product exported to the world, more New South Wales product exported to the world. That's always driven me, and it always will.
Other states and territories are exporting as much as Victoria, or potentially even more in the case of New South Wales to China, for example. So is there any reason to be signing a Belt and Road Initiative?
Well, we don't dig money out of the ground, Samaya, so it's always challenging to do detailed comparisons. You know, we don't have we have many of our own strengths and riches, but we don't have some of the natural deposits of that are a feature of the arrangements that other states have. But again, if the Prime Minister's got the time to be focused on these matters, that's fine. That's entirely a matter for him. I don't. I think my position on these matters is very clear. And fighting the virus, that's really important at this point in time. I think probably the most important thing. I'm only speaking for myself. That is what I am absolutely focused on. And I don't really know that I've got a lot more to add. My views on these matters have been well canvassed, and I think you're all very, very clear on my views on these things.
How worried are you that this is going to land a further blow to the Victorian economy that has already been crippled, like global economies, because of the COVID pandemic?
Well, the point that I just made before, presumably this approach will be will include quite soon a very detailed list of alternative trading arrangements, alternative free trade agreements, alternative markets. I'll leave that to the PM to announce, but presumably that's coming, and it's coming pretty quick.
And in the event it doesn't?
Well, I wouldn't want to speculate on those things. I'll leave it to the Prime Minister. He seems rather focused on these matters. I'm much more focused on fighting the virus. I'm much more focused on creating jobs. And if you want to describe that as staying in your own lane, absolutely. I'm absolutely focused on fighting this wicked, deadly pandemic and then rebuilding and repairing the Victorian economy thereafter. That's what I'm focused on. And I think exports, no matter what country they get sent to and no matter what product they are, will be a really important part of that.
Premier, you seem pretty angry about this announcement from the federal government.
No, I wouldn't read that into what I'm saying at all.
Oh, you've been more heated in your comments this morning than you have been at
Well, how you describe my comments is entirely a matter for you, but believe me,
Well, how do you feel
I'm in
about
no
it,
way,
Premier?
I wouldn't describe my comments like that, but I'm not a commentator on me. I'm just being as clear and as frank as I can be.
How do you feel about the federal government's announcement?
It's not about my feelings, it's about the fight against this virus. That's all that matters. It's all that matters.
Did the Prime Minister tell
That's
you it
all
was
that
coming?
matters. Sorry?
Did the Prime Minister tell you it was coming?
Oh, I got a letter last night.
So no text or phone call?
Oh, there's many different ways to communicate. I got a letter. I'm not seeking
A
to...
letter in the mail or a letter
text a
by
lot with him.
email or?
Well, again, let me be clear. I'm making no criticism about the method of communication. Just to be absolutely clear. If I had time to worry about how I got told things, really, that is not where we're at the moment. I've tried to be as frank and as honest with you as I can be. I've done that. My focus, my exclusive focus, is on fighting this virus, dealing with this second wave, and then having a comprehensive plan, which I will lay out step by step to repair the damage that this wicked enemy has done to our state, and I'll make those announcements in due course. That's what I'm exclusively focused on. And if I might be so bold as to give you my sense of what the Victorian community want me to be focused on, I reckon they want me to be focused on this pandemic, on this virus, on getting to the other side of this second wave. At least that's my judgment. You know, others may have a better sense of what Victorians want, but in my humble view, I think that is what is absolutely important, and that's why I'm completely focused on it.
What time did he send the letter?
I don't know.
The federal government said this morning it was going to review all of the existing arrangements that were in place. Do you think there's a chance that Belt and Road might survive that review? Or do you
That's entirely a matter for them. Again, I think I've probably spent more time in this press conference on that relationship than I've spent on that relationship in the last 5 or 6 months. It's an important relationship, it's one of many, but that's the point I'm trying to make. and I wouldn't describe it in those terms. The point I'm trying to make is that my focus and the focus of my team is where it should be, and that is on fighting this virus.
How many trade deals does Victoria actually have with China right now?
I'd have to, sorry?
How many
Alex?
trade deals do we actually have with China right now?
Well, it's a question of how you describe we. Do you mean like private sector arrangements, deals between universities, private companies, or government arrangements?
Do we have any in place in any of those sectors?
Well, I'd need to come back to you on that.
In terms of,
And while I'm at it, I might come back to you on a few other arrangements because they exist with Japan, the United States. Like what we've got at the moment is that this I assume includes sister city arrangements as well. I'm not sure who the sisters. We mentioned my old hometown of Wang earlier on. I'm not sure who their sister city is, but that's apparently that's a priority. Apparently.
Following you signing that Belton Road MOI, whatever it's termed, how many deals has Victoria made with China following that?
Well, it's Alex. I think I've gone to this a number of times.
Is there any?
Alex, I've gone to this a number of times. There are many different arrangements, many different deals, as you put it. Some of those relate to the university sector, private companies. Some of those relate to the export of goods and services. Well, having been pretty clear with you where my exclusive focus is, I'll come back to you if and when I'm in a position to do that. Because I think the virus is something that I should be spending my time on, and I am.
On to the virus, how do you feel about the Dandenong protesters and their daily protest?
Well, protests are not lawful. Protests are not safe. Protests are not something that should be happening, no matter what the purpose or no matter what the stated reason is. I just don't think that's in anybody's interest. That will mean, you know, that it takes longer for us to get past this second wave. It'll put at risk a lot of the gains that we've made, and I think everyone should be focused on that. As difficult and as challenging as these settings are, getting to the other side of them, that's what we have to be focused on. Certainly what I'm focused on.
When did the Prime Minister last write to you about the Belton Road initiative, or talk to you about it?
I'm not sure.
Prior to last night?
I'd have to check. And I'm not really interested in having a debate with the PM about this today. I've answered your questions clearly, and I've made the point a number of times this morning, and I'll keep making the point that that is not my focus. My focus is getting past this second wave, and I think that's what Victorians would want me to be focused on.
But I guess a lot of Victorians would also be concerned about what this would mean for their businesses and their jobs into the future. If this
Yeah, and I can't really speak to that. I can't speak to that.
So if you're worried about the Australian government ripping up the Belton Road initiative or the memorandum of understanding that Victoria has with China, are you conceding that the deal is not in national security interests?
No, I'm not conceding that at all.
So how worried are you about the agreement?
Well, I'm not, because of course I'm very confident that the PM will be able to outline a whole series of important arrangements for the future.
But if it is in the national interest and there is an issue with the BRI deal with China, presumably it won't be ripped up, yes?
Well, again, you'd have to speak to the PM about that. I think honestly, in the last however many minutes it is now, we have genuinely spent more time on those arrangements than I've spent on them in the last 6 months, because I'm focused on dealing with the matter at hand. Exports will always be important, no matter what country they're being sent to, and no matter what product it is. That's the point that I'm making, and we'll always advocate on behalf of Victorian business. We'll always advocate on behalf of Victorian jobs. That's a really important part of our job. But the most important job at the moment, again, in my judgment, is to be focused exclusively on this second wave, getting past it, and making sure that we can then open up and that we can repair the damage that this pandemic has done in so many different ways.
Do you think that the federal government's announcement is directly targeted at Victoria, and do you think it impinges on states' sovereignty and ability to run their own race?
I'd offer no comment on that. You'd have to speak to them. Again, foreign affairs is a matter for the Commonwealth Government, but growing jobs and sending Victorian product overseas and helping businesses to be more profitable and employ more people, that's a pretty big part of my job too. Beyond that, as I can only again say to you, you guys are entitled to ask all the questions you want to ask. I've never been critical of that, nor would I. But I do reserve the right to perhaps make the point that we've spent more than enough time on something that I really don't think is the number one priority at the moment. We're in the middle of a state of disaster. We're in the middle of a pandemic that is deadly. We need to get to the other side of it, and people may criticise me if they choose to for being exclusively focused on that, but that's not really my concern. This is not a popularity contest, it is a pandemic, and we need to get to the other side of this second wave, and that's what I'm focused on. And whether it be making sure we've got the best response in private aged care, the best response in disability settings, the best response in our hospitals, the best response in every setting, in every way. That's what I'm spending a very big portion of every day focused on, and I think that that's exactly what Victorians would want me to be doing.
You established a joint disability task force with the federal government
Yes.
last week. How's
Very
that
grateful
going?
to the federal government. It's a really important step forward. I haven't got an update on it, Samaya, but I'm happy to get you one. We know that in a number of these disability settings there are many vulnerable people, and we don't want it to get in there the way it has got into aged care, and we think working together and being one team, as it were, is a really important part of that. I can go back to active cases, which are coming down, and we're very pleased to see that, because we don't want anybody, if we can get to a point where there are no active cases in those settings, that would be a very good outcome. So as at the 26th of August, there are a total of 48 active cases, and my notes tell me that it is 34 staff and 14 residents. And as for the work, and again, I'll thank the Commonwealth Government, very important development. It was really an extension of existing arrangements, and it mirrors in many ways the way aged care is being dealt with. If I can come back to you on any further information about that, I'm happy to.
Just on healthcare workers, Premier, do you have any data on how those infections are happening in clinical settings like hospitals?
I can have Dr. Andrew Wilson, who is the head of Safer Care Victoria at the moment and the Chief Medical Officer. I can have him come back to you. There was a big piece of data, a big report, a big analysis of perhaps the largest data set that we've ever had, and we made a number of announcements about that earlier in the week, but I'm more than happy to have that report made available to you and any questions you want answered.
The AMA is calling for fit testing to be rolled out at every hospital immediately. They say that it's not good enough that there's only one trial at one hospital. Why isn't fit testing being made available absolutely everywhere across the state?
Well, the best thing for me to do is to have the Chief Medical Officer, who went directly to that, I think, a couple of days ago, and he can take you through the reasons why, in clinical terms, a judgment has been made to trial that in one setting, and he's probably best to be able to provide you with all the medical opinion and all the other detail that you need.
The AMA is saying that it's putting the risks of healthcare workers on the line. What's your personal view on that?
Well, I wouldn't offer a medical opinion. I'm not a doctor. Andrew Wilson is, and I'm more than happy to make sure that he speaks to you.
Police seem to be bearing the brunt of enforcement in terms of door knocking and making sure people are at home. Would you like to see the authorised officers from DHHS perhaps issuing a few more fines? It's the Police Association that have raised the concern that it's bearing.
Yeah, I haven't seen that concern from Wayne, but I'm happy to look at that. Ultimately, members of Victoria Police are doing an outstanding job. They're supported by lots of different, whether it be authorised officers of the Department of Health and Human Services, members of the Australian Defence Force, to whom we're very grateful. It is a team effort, but I'm happy to look at Wayne's issue. That's the first I've heard of it. If I should have known earlier, I'm sorry about that, but I'm more than happy to chase it up.
Can we just clarify, so the ADF, if they're door knocking, unless they have an authorised officer or a police person with them, they can't issue enforcement?
That is my view, yes. And it's almost, I think, Alex, and again, I'm happy to come back to you. My understanding of the way this is working is you've got a member of the ADF, maybe even two, then an authorised officer of the health department, and they go out and do the door knocking. Now, if a matter is referred to Victoria Police, then Victoria Police would take that on in terms of investigating why a person wasn't at home. Or then, of course, there's all the other work around foot patrols, things like we saw out in Dandenong last night. There'll be a pretty heavy reliance on police to deal with some of those matters. I want to make the point as clearly as I can that I appreciate and understand these are very challenging times for members of Victoria Police. I think they're doing an outstanding job in very difficult circumstances. I think the way some police have been treated is just shameful. I made contact with the constable down in Frankston who was injured, and again, I'll send my best wishes to her family, and to every member of Victoria Police and their families. This has been a pretty tough year for Victoria Police, but they're doing a great job in very difficult circumstances.
Can we just ask Gab, being the local member
Can I
down
just ask one more?
Sure,
Oh, yeah.
no worries, Alex. Yep.
And just on essential workers, the fact that childcare workers are actually losing their jobs in Victoria as a result of the lockdown because they don't, they can be paid under the agreement that the federal government has, but
Yep.
they're not eligible for JobKeeper.
Yes.
But a lot of them are actually being laid off. Will you speak with the Prime Minister on this matter, because it seems like it's actually impacting quite a lot of women?
Let me follow that up. What we know is that, and this is not to downplay the fact that there is very significant impacts across the board, but we do know there's mounting evidence that more and more women are being very, very significantly impacted by this global pandemic. And that response that I talked about earlier on and essentially foreshadowed a whole series of announcements. There'll be many of them in the lead up to the budget. We will take account of that fact. We'll take account of some of the issues Lundy raised in terms of mental ill health and anxiety and some of those challenges, some of the things that Gab's talked about in terms of family violence, that whole notion of insecure work and the pressure that that's putting on people, and that's really been exposed in the last 6 months or so. There'll be a lot of those very challenging things, negative things, if you like, that have been exposed. There'll also be, might I say, some other things that we'll need to account for that aren't as negative as that. For instance, the fact that many people are, rather than a concept of working some of your week at home, many people have now done that for 6 months, and I think that many will want to try and hang on to that, to having more flexible arrangements, for instance.
That sounds like a much larger and longer term kind of process. So just going back specifically to the childcare.
Yeah, absolutely.
issue,
I'm
does that
happy to
happen
come
quite
back to you.
quickly? Will that happen? Will you speak to the Prime Minister?
Well,
let's say, in the next-
what I'll do, we speak very often about many issues. I'm more than happy to look into the matter and get properly briefed on exactly how it's playing out. And if I have to raise that, either me with him or one of my team with one of his, more than happy to do that.
Just before we throw to Minister
No problem at all.
Lundy, if that's okay, I know you can't foreshadow what the future's going to look like, but
Sadly, I cannot, no.
there's a significant push at the moment for people who are living alone to nominate a support
Yes, there is.
person.
Yes.
Is this something that you would consider maybe introducing in the next?
We're having a
budget?
close look at that, and again, as soon as we can, back to Alex's and Lundy's point, I think as soon as we can give every single Victorian a meaningful and, as best we can, a certain picture of what the next month, 2 months, 3 months is going to look like, then we absolutely will do that. But I never want to stand here. I never want to stand here and make announcements that, as I'm making them, I know that they're just not likely to happen. I think that doesn't serve anyone well. I know it's tough. I absolutely get that. I get it. But we've got to be guided by the numbers. And sadly, one of the most frustrating things about this is that you can't stand at a podium like this and make 100% certain predictions of what's going to happen even in a short period of time, let alone a long period of time.
But is this something people can look forward to?
I think what I can say to you is we are actively looking at that issue, and when I'm in a position, and it won't be on the 12th of September that we talk about what's going to happen on the 13th. We'll give people, as we've tried to all the way through, as much notice as we possibly can.
Father's Day is coming up, and we're all going to be in lockdown. What's your
Yes.
your message to people on Father's Day?
Dads are great. I'm not quite sure what I can.
In terms of staying home and
I hadn't anticipated that question today. I thought you'd be more proximate to Father's Day when you asked me for my Father's Day message, but let me work on it. Let me work on it, and I'll come back to you with something that's even more pithy than that.
Just one more on the masks, Premier. Why is fit testing being trialled 6 months into the pandemic when we've seen so many health workers affected?
Well, as I've said to you, and I'm not trying to be anything more than clear, a couple of days ago, and you weren't to know that, a couple of days ago, Andrew Wilson, as the Chief Medical Officer, stood here for a very lengthy press conference. I think we almost broke the record, almost, going through all these different matters. I'm more than happy to connect him with you, and he can take you through all the things that we are doing and why, and the medicine and the science that sits behind that. We value each and every member of the team, clinical staff as well as the non-clinical staff in our hospitals. Healthcare is delivered by teams of people, and we are committed to and invested in the safety of every member of that team in every single workplace. But as for the specifics and what has driven the clinical decisions, and there is a task force, and I believe that a number of peak bodies, some of which you've referenced today, are members of that task force. Andrew will be the best person to take you through that.
I completely understand that, but the AMA is saying that this is too little, too late, and the government is still not doing enough, even though it came out with that data the other day.
Well, again, I'm not here to be a commentator on the commentary of others. All I can do is not only refer you to Professor Wilson, but I will actually secure you time with him to talk about these issues. I can't offer any more than that at this point. We did canvass these issues in some detail. It's very important issues, and that's why there's a power of work going on, and literally tens of millions of items of PPE being sent out to our hospitals on the day that they're
can't be worn properly, and there's no fit testing in place to ensure that they're worn properly. How can the health workers have confidence that that's going to protect them?
Well, I wouldn't accept the conclusion that you've drawn. What I'd say to you is that rather than me pretending to give you a medical opinion and me pretending to be someone who can provide you with that sort of advice, why don't I connect you with the person who can, who's actually paid to do that work and who is doing a mighty job, I might say, and who stood here the other day and answered many questions on these issues and others. Everyone's working as hard as they can. Everyone's working as hard as they can, and I think we're making significant progress in a number of these areas. He's the best person to take you through that.
Can I please ask Alan just...
Absolutely. Did someone want to ask Gab something first, or? Well, I'm not fussed. You can.
No, go for it.
Thank
Laurel.
you.
Either way. Either way.
Just generally tell me what you think about the number 113 and what you think is providing the best source of optimism at the moment, and what's your greatest concern in the numbers and the trends?
Look, I mean, numbers go up and down. You know, we're not looking at a single number, we're looking at a trend over time. So we're looking at that number is obviously encouraging, but if it went up, you know, slightly tomorrow, I wouldn't be too disappointed. But I would like to see over, you know, some days that number trending down, and hopefully to next week we'll be getting under 100. We're also looking at a whole lot of other things, so testing rates has been mentioned, the number of cases where we can't find, you know, a source, a mystery case. We're also looking at all the outbreaks that are going on, and trying to make sure that there aren't new ones, making sure that where there are outbreaks that, you know, every last case is chased down, and all those trains of transmission are stopped. So it's not a single figure that we're looking at, but really sort of a whole lot of different things that we're keeping our eyes on.
So what's giving you some hope? What are you pleased about when you dive into those figures?
Oh, I mean, you know, if you look at where we were a few weeks ago when we had, you know, 500, 700, you know, we're clearly a lot better, in a lot better place than there. And that certainly is reason for hope. I think that, you know, if you look at where we have come since stage 4 came into play on, I think it was the 2nd of August was the first announcement of that, you know, the numbers are very significantly down on that. And that, you know, as in the first wave, I think that's really encouraging. We can do this, you know, together, all Victorians, if everyone's playing their part, we can get these numbers down. We need to get them further down, but it is possible to do. You know, particularly if you look at other countries, you know, a lot of other countries are not having such a happy time of this, and, you know, we know that we can do this.
Not to bring the mood down, but I think that the death rate is the highest at the moment that
Yes,
it's been. Is that to be expected given the lag time, or is it to
Yeah,
what you expect?
so, you know, clearly it's a very difficult time for a lot of families. There are a lot of people that have succumbed to this, and this reinforces why we're doing all this. If there were cases and no one came to harm because of it, then we wouldn't be so concerned. But the fact that we are seeing people continuing to die is reinforcing why we need to take all the actions that we have and why we're taking this so seriously. There is a lag between when people get sick and when they recover or die, and that lag is usually 2 or 3 weeks. So what we're seeing now is people that got sick a number of weeks ago.
As a public health expert, do you believe the incorrect wearing of PPE, including masks that aren't fitted properly, has contributed to the high number of infections among healthcare workers in clinical settings?
Look, I think I'll let Professor Wilson speak to that. I am a hospital doctor. I'm confident in the PPE that we have. There are processes that we follow and we practice them, and there's a lot of training and other measures going on. But I think in terms of fit testing and those other things, I'll let Professor Wilson speak to that.
Just to clarify, so 2 weeks ago, the message was that regional MPs shouldn't go to Parliament, and now, well, we should avoid it and take precautions. Now, I think there's just been a letter sent round saying that they can attend with certain things in place. What is the difference between now and 2 weeks ago, where we now consider this as...
So it's a workplace. Parliament's a workplace like any other. We provide advice, and the presiding officers they run the workplace.
But what was the difference that changed your advice in the 2 weeks, allowing them to now attend?
So, as I understand, there are constraints on what can happen in Parliament, and there was a decision that was made that they were permitted to come, and so the advice that we provide is how do we make that as safe as possible.
So you were asked to make it as safe as possible so they could attend?
So, no, I think the decision was made that they were coming, and how could we make that as safe as possible, so we provided that advice.
So who made the decision that so you were
the
told
the
by
presiding
Parliament
officers
that
run
it was
Parliament, so
okay.
run the operations of Parliament, so that's how I understand it to be. So, yeah, to be clear, this is Professor Sutton provided that advice in the last couple of days, I think. But, yeah.
So the last time Parliament, sorry, I'm getting a little bit confused on that. So the Parliament said that they didn't want to have regional MPs or sit last time, so the recommendation wasn't made. And this time they said that they do want to, so now...
So we were asked for advice on how could regional MPs sit, and how could it be most safely done. We didn't make the decision to say they could. We said that was presented to us as a request for advice, as I understand.
What's the latest evidence regarding aerosol transmission, particularly through, say, ventilation in a clinical setting?
Look, I think I'll let Professor Wilson speak to that.
Any other issues? Did you have one for Gab?
Oh, Gab, I was just going to ask, with your local member hat on, what your view of the Dandenong protest was last night. Is there a particular issue in Dandenong with, I guess, community attitudes towards the current restrictions?
Well, look, as a local member, it's my community, and that community in that pocket of Dandenong South are one that I'm very close to. I know many of those families down there, and have been in contact regularly over the last couple of days with Mayor Jim Mehmedi down there, who's also very closely connected in with the community there. All I can say is, as we all know, stage 4 restrictions are hard. You know, a lot of people are frustrated. We all know they're difficult. They're difficult for all of us. But the best way to keep all of us safe, particularly the most vulnerable in our community, is if we all follow the advice of the Chief Health Officer. The scenes that were displayed on the news in the last couple of nights are no doubt were very disturbing to me, very concerning. They gave me cause, as I've said, to reach out to the Mayor, Jim Mehmedi, and to find out what those concerns are in the community. We've started a process of contacting community leaders to make sure that we're offering support where we can. That includes both social support and business support, that we're making sure that people are connected into the assistance avenues that the government has put in place and that local community organisations have put in place as well, and also that we're ensuring that there's a provision of accurate information going into that community too. That's the most practical thing I can be doing as a local member with the Mayor and local government as well, and we hope that the sorts of scenes that we saw displayed on the news last night and the day before hopefully don't continue, because at the end of the day, much like the Premier has outlined about where his priorities in keeping the community safe, as a local member that's mine as well. And obviously any large gathering of people is concerning during this period of time when we're trying to keep the numbers infection rate low to as low as humanly possible. Those sorts of scenes are quite concerning. So if we can get a better information flow into the community, we can get assistance to those who most need it, and make that community feel supported, then we think that's our best mechanism of being able to deal with that issue.
Are you concerned at all that the actions of a minority of few people is actually causing a little bit of racism towards the different communities in the area?
Look, as we've seen over the years in various incidents, racism, is a toxic phenomena that rears its head from time to time. I'd cause to look at some of the social media that was circulating last night and was disturbed by some of the racist commentary that was coming out. I proudly represent the most multicultural community in Australia, very proudly. It is what makes us unique. I think it makes us an example to the rest of the world. So anything or any commentary of that nature is not welcome in my view, and it's certainly not welcome here in Victoria. So yes, I'm concerned when I see incidents like that being used as an opportunity for racist dialogue. But as I said, our focus remains wholeheartedly at the moment on keeping numbers low, on keeping our community safe, on making sure that some of the most vulnerable members of our community are kept safe in that time. And I know, can I say, that for most of those in that pocket of my electorate in Dandenong South there share those concerns and want to be and care about their families and their elderly parents and their relatives and children as well. And so whatever we can do to make them feel supported at the moment is my priority as local member.
A couple of months ago, police and family violence services were worried about a decreasing number of potentially victims calling for help. Is that trend still continuing, or?
Yeah, as I outlined last week, the data on this is a little bit all over the place. The reason being that we have multiple points of data that we would look at, avenues of data that we would look at in order to be able to get a complete picture of what the trends are at the moment in terms of family violence incidents. So we look at police reports as one avenue, but we also look at contacts with specialist family violence services, as well as child protection and a range of other sort of community services that would be intersecting with people as well. And so the trend as a whole was effectively that as we've gone into periods of lockdown, the reporting dips. And then as we start to open up, it starts to climb. And that's what we anticipate will happen from here on in as well. But what we've also seen is that the complexity of cases that are coming into contact with the service system has grown. So those cases are of a much higher complexity, which obviously also involves the service system having to spend more time with those clients to unpick the various elements of those cases, as well as, of course, reports that many of these cases may be people who haven't before experienced family violence as well. So that's in addition to those who may have a history there. So the data has shifted as our circumstances have shifted, as you would expect. We're obviously doing all we can to push out a very clear message that if you are at risk of family violence, or if you are indeed experiencing family violence and you are able to leave, and that the service system is still there to assist you. The method through which it assists you might look a little bit different at the moment, but it is still there. Services are still operating, and I know they're doing all they can to put that message out to the community as well.
And has there been an issue with service delivery, if particularly if staff getting furloughed for either contracting coronavirus or being in close contact?
We've made a series of investments to assist the family violence service system to be able to meet the demand that it's experiencing, and to be able to meet the complexity of the cases that they're experiencing, and to be able to operate in a very different environment. So a couple of months ago we announced money for both emergency accommodation for those who needed to isolate outside of their homes for their own safety. We also announced as a part of that package about $20 million that went towards assisting the service system to be better able to cope with this current environment, everything from sort of tech support, etc. Some of the most basic things to some of the more sort of complex workforce issues. What we do know is that the workforce remain extremely committed to playing their part, and they're often being quite innovative in that process to make sure that they are still reaching out to the people that they know need help, and that they're available to be contacted themselves. And that work continues, and it will continue, and we'll be doing everything that we can to support it.
Premier, just one final question. You'll be a better expert on this because it relates to the 2008 legislation that I believe was introduced by yourself.
Very pleased for you to describe me in those terms.
There is a clause in there that says that people are entitled to claim a form of compensation if the health directive is
not proportionate.
Yeah. Has this been a consideration at all when you've been considering the lockdowns, and do you think that possibly people will be able to activate that?
Couple of points. Firstly, those are matters for the Secretary of the Department of Health and Human Services to deal with in the first instance. It's not a politician who determines whether that is an appropriate thing or not. So that's the way the Act is designed, if memory serves me correctly. The second point is to make that each and every decision that we've made has been on the basis of advice, and the advice, one of the key considerations that our public health team uses when they come to providing advice is what is a proportionate response to the risk and the challenge that we face. That whole notion of being as proportionate as possible, that guides all the advice that's provided, and it's certainly guided us in the decisions that we have made. It's always very challenging when you're dealing with something that's novel, 1 in 100-year event, but being proportionate, but at the same time exercising a precautionary principle, that is what has driven us all the way through.
And there'll be no changes to that clause in the amendment?
No, I think that there is a clause there. There is a mechanism for people to apply to the Secretary of the Department, and that's entirely a matter for Victorians to deal with. Beyond that, are there any other matters? I just simply say, if you've got symptoms, even the mildest symptoms, please come forward and get tested. Please stay at home till you get your test result. And I want to say thank you to every single Victorian who's doing an amazing job in difficult circumstances. We are equal to this task. We will defeat this enemy, and we will have more to say as soon as we possibly can about a plan for recovery, a plan to rebuild, a plan to open up. That's got to be guided by the numbers. Otherwise we won't have defeated this second wave. We'll in fact just be beginning a third wave. We don't want that. We want to make sure that we do everything we can, and that's why I'm so deeply grateful to every single member of the Victorian community who's following the rules. That's why these numbers are falling, and it's why they'll fall further in the days to come. And then we'll be in a position to outline very comprehensively detailed plans about massive investment to make sure that we look after jobs, families, the Victorian community, and that we get back to that position of strength that we're so well known for. If there are no other matters, I will see you tomorrow.
Thank you very much. Masks and your shopping bags, yeah.
Yeah, Lisa Lamas has arrived.
Thanks very much.